This
chess.
conference will now be recorded.
And I'm soon going to be starting to working towards a super specialization in endocrinology. So that's something that I'm looking forward to. Today's session is on OET speaking. Um, I know lots of people, they suggested that we try and do OET speaking in particular today. So that's what we're trying to do on popular demand. Why this is called a cheat sheet is because we'll be trying and making our life easy to plan our future OET speaking tests. So we'll try and give out sample phrases and sample introductions that you can use on your OET speaking in order to maximize your score. Lots of people, they struggle with OET speaking because they have problems with confidence, because this is the only practical portion of your OET test. So in order to minimize that confusion or to minimize that nervousness, we've introduced this cheat sheet. So you'll have sample phrases and sample examples that you just have to cut, copy, paste, and apply it to your future OET speaking sessions so that you can increase your scores. So we'll start with a brief introduction, which probably you already know. That OET speaking, it consists of 2 sessions, which are one-on-one live sessions. Speaking is usually conducted later on in the day once you've finished your reading, listening, and your writing. And there's usually a gap in between your speaking and your rest of the sessions. So people often get very, very tired in OET speaking because it's the gap is quite a lot. Some people, they like to practice with their exam mates, so that's something that you can try. Some people, they practice with their exam mates in between their speaking and their rest of the session. So you can try that on your future sessions as well. Um, so you have one person who's going to be in the room where you walk into, and they will be conducting the OED speaking with you. They will be simulating the role of a patient or a patient's relative. So it's very, very important that you read your task properly and you understand what the role of the interlocutor or the person sitting in front of you is. Okay. So because they're going to be playing the role of someone who's going to be quite different from the way that they look, you might get confused sometimes. So try and read your task properly to understand what your interlocutor is and what role they're playing. Okay. Um, you get 3 minutes to prepare. So when you walk in, you introduce yourself to your interlocutor, you get a task card, and then you get about 3 minutes to prepare on your task. And the actual task itself is about 5 to 7 minutes each. And then you basically go through what your task asks you to do, and then your role play ends. And everyone knows that you do your own role play. So you play a nurse or a doctor, depending upon what your profession is. So it's very, very similar to what your life would be working as a doctor or a nurse in the NHS. So that's why try and use the OET speaking as a primer to what your life is going to be working as a doctor or a nurse in the NHS. Everyone knows this again. How are we assessed on the OET speaking? The person sitting in front of you isn't going to grade you. They only send your recordings to a set of 2 separate examiners. Remember, these are voice recordings. They're not camera recordings. So if you're doing something to show sympathy or empathy, if you do a visual cue, the examiner might not know that you're doing it. So make sure that you verbalize if you want to do something. For example, if you're leaning forward, then you say, I can understand that the situation is a little bit difficult for you. So you're supposed to verbalize your sympathy, because they won't be able to see your body language completely. And because this is going to be graded by a separate examiner and two separate people, they have set criteria for grading your speaking. Let's just look at the criteria and then we'll move on to how we're going to be doing our sample answers. So there are two criteria, two basic broad categories by which your speaking is graded. That's going to be your linguistic criteria and your clinical communication criteria. So linguistic criteria basically means your level of language. Okay. So in the linguistic criteria, they're going to be looking at four different things, which are your intelligibility, is that your pronunciation should be easily understandable; fluency, that the way that you're talking should be at a normal speed; appropriateness of language, that the way you're talking should be appropriate to someone who's working in a professional area, or who's working in a nurse, who's working as a nurse, or who's working as a doctor. The language shouldn't sound too casual. And resources of grammar and expression, that is how good your language is. Are you using full sentences? If you want this to get explained further, if you see my previous videos on YouTube, you should be able to get an idea of all of these criteria in detail. So you can go back to our YouTube videos to see these in details. Today we'll be doing samples and examples rather than focusing on this. But if you're still confused, you can see my previous videos. And then you have your second broad category by which you're graded on the OET speaking. That's your clinical communication criteria. They're basically four things. Whether you're able to build a relationship with your patient, are you able to understand and incorporate the patient's perspective, which means that you're able to incorporate what the patient wants into your clinical communication. Then they ask whether you're able to provide a structure to your discussion. Is your discussion purposeful and logical, and does it follow a particular flow? Then indicators for information gathering and information giving is basically just having a good communication, a two-sided communication with your patient or the patient's relative, taking questions from them, answering them appropriately. If they're asking you to explain something, are you explaining that in a layman's term? Are you able to clarify the questions that they're asking you? So it's basically very, very similar to basic medical communication or basic nursing communication, which you're going to come and do when you join us in the NHS. All right, now that we've just briefly touched upon what is actually assessed on the OET speaking, we'll go through some practice samples and then I'll give you some templates which you can use when you do each and every OET speaking session from now on. A lot of people get confused when we conduct mocks in teacher with on OET speaking, because they're unfamiliar with OET speaking. They treat it very, very differently. Remember, this is an English exam. So when you're doing your OET speaking, they expect you to have full sentences and they expect you to have proper grammar and proper clinical communication when you're doing your OET speaking. This is not a medical exam. So even if you're giving out information which might be medically wrong, if you're doing that in full sentences and you're answering each and every question of a patient, you should be able to pass. So I would advise you to focus more on creating full sentences rather than giving out the best or the most up-to-date medical language. By intuition, that sounds very, very wrong, but again, remember, you have the time you will have exams in the future which will evaluate your medical knowledge. This is not the time to give out the best medical knowledge that you may have as senior doctors or nurses. This is an exam only to evaluate your speaking or only to evaluate your English, okay? So make sure that you're using full sentences. All right. So we're going to start with a session with an example for doctors first. I'm going to give everyone about 2 minutes, or let's just make this similar to what would happen in an exam. So I'll give you about 2.5 minutes to go through this task. And what I want everyone to do is treat this like an exam. So you should have a pen and a paper in front of you, and I want you to make notes as to what kind of notes would you use when you do your OET speaking in an actual test. So I want you to make notes regarding this example on a pen and a paper, and then I'll give you a sample of what I think that my notes would be if I face this task on my OET speaking. So everyone, 2.5 minutes, make notes on a pen and a paper that you would do with regards to this task on your actual OET test. I know we've got lots of nurses with us as well. Nurses, even though this is a medical task, I still want you to make notes on this task like you would make on an OET test. The rules are the same for doctors as well as nurses. I want you to make a good set of notes using this task. And when you guys finish putting in your notes, please type in yes in the chat window. I just want to see how much time you're taking on making notes for OET speaking. Guys, please type in yes when you're done making notes for this task, and then we'll discuss how we'll go through this task as an example. Excellent. Now what I'll do is now I'll tell you how I would make my planning, or how I would plan my letter if I was faced with the task. Guys, I keep on emphasizing this again and again. You need to plan your speaking. This will be your first practical exam that you'll come and do before you come and work in a foreign country. So it's very, very obvious that you'll get extremely nervous, but with proper planning you will be able to prevent this. And proper planning starts by planning your task. When you're given your task, you plan out your case notes. So this is how I suggest everyone to make notes with regards to any OET speaking task that you get. Okay, so you write down where. So in this case, that was your practice or your general practice. Who is the patient in front of you? That was a recent patient discharged from hospital. So I write that down. Then I write down purpose, discussing a patient's recovery. So I just write discuss recovery. And then I write down my task points as T1, T2, T3, T4, and T5. Okay. So in T1, I just write the main point. Okay. Fatigue is common. So in the first part, I'm just going to explain to the patient that it's common to be tired. In the second part, cardiac rehab at nearby hospital. So my task, the second part of my task is that I'm going to explain to them that cardiac rehab is to be offered, which is at a nearby hospital. Why have I written nearby hospital? Because lots of people get confused where the cardiac rehab is going to be, and they start talking about cardiac rehab in the same place. Okay, but it clearly states on the task that the cardiac rehab was at a nearby hospital. And the third part of your task is that exercise is good. It'll help low cholesterol, strengthen heart, and lose weight. So then I know that in my third part of the task, I have to discuss about benefits of exercise. Then the task point 4 is that I have to reassure the patient. So I've just written reassure, and then I've written concerns are okay, and then I've written that you need to pace exercise in 4 to 6 weeks for work. So that's just basically, it's the reverse of writing, that I'm paraphrasing or I'm creating short forms for things that I have to cover in my speaking. Then task 5, future recommendation, diet, relaxation, and stress, because that was the thing that was suggested for us to do during this task. And then I've just written conclusion, just to remind myself that I have to conclude my speaking as well. Okay, so guys, if you understood the my my sort of format of making case notes, that is just the things which are in bold: where, who, purpose, and then T1 to T5 and conclusion. Then just type in yes, or you can take a screenshot of this, and you can apply this on your future OET speaking. This is very, very helpful, um, because when you got your task, it was quite big and it had lots of sentences. So when you're doing your actual speaking, it would be very difficult to go down and start reading your task again. um, but these notes are actually quite easy to follow, and even when you're speaking to someone and your eyes shift downwards, then you will be able to identify words very quickly. So just take a screenshot of this and we'll try and use this on our future examples as well. So that's where, who, purpose, task, and conclusion. Okay, where you're writing where, you can also write your role. So in this case, I wrote down GP or a general practitioner. You may write medical registrar, you may write lead nurse, you may write ward nurse. So you have to write your role as well. Okay, moving on. Then I would plan my uh, question. Then I'll plan my question timeline. Now, this is very, very suggestive, or you might not be, this is just a suggestion. You might not be able to do this on your actual OET speaking, but roughly you would spend about 45 seconds on your introduction, introducing yourself to your patient, asking your patient's name, explaining the purpose of your meeting. Then you go on to your task. Seconds is actually spelled incorrectly. That shows that you can also make mistakes when you become senior. So 45 seconds each for each of your tasks, and then you'll have about a minute for your questions or doubts that the patient might have, and your 1 minute would be your summary and your conclusion. So that's very, very roughly, and you might not be able to do that on your actual test, but just have a plan in mind as to that you have to cover your task points, so be a little quick. All right. Now you can take a screenshot of this as well. This is sample introduction that you can do. Guys, remember when you are making your notes, you can ask your examiner as to how they may address, how you may address them, and they might give you a name, for example, May or June, or they might give you a name by which you can call them, like John. Um, in that case, you don't need to say how may I address you, but you still need to introduce yourself and you need to ask their name. So you might start out with something like, hello, my name is dash. I am a dash working in this practice. Is that dash? So you're going to use this when you already know the patient. So examples like this might be if you are a ward nurse or a lead nurse, or a patient and a patient is getting discharged, or you are a medical doctor and you're working in a ward and a patient's relative has come to speak to you. So in that sort of situation, the patient might be familiar to you, or the patient's relative might be familiar to you, and that's when you're going to be using the first line. Now you might have another example when the patient is new to you and the patient is in your hospital or in your clinic. So then you're going to say, hello, my name is Dash. I am a medical doctor or a registered nurse in this hospital. Full stop. I will be taking care of you today. If you're admitting a patient, you might change that to, I will be taking care of you while you're in this hospital. All right. So just note down that sentence, I will be taking care of you while you're in this hospital. Full stop. Can I please just confirm your name and date of birth, please? If this is the first time that you're seeing this patient, you can put in this line as to, can I please confirm your name and date of birth, please? The third option is when this patient is coming to you in a clinic. Please note that there's a subtle difference in this sentence. Hello, I am dash. I am the dash in this clinic. Okay. In the previous two sentences, it was I am a nurse. I am a doctor working in this hospital. But in the third example, it was I am the lead nurse, the medical registrar, the consultant. So the difference why we've used a in the first two sentences and the in the last sentence is because a you use when you're a non-specific word, like you're a nurse, you're a doctor, you're a physiotherapist, you're a dentist. But the is used when you're pointing to a particular person or a particular object. So the medical registrar, so that's a particular position in the hospital, and that's why you write the. Okay. And if it's a consultant, then I am the consultant in this clinic. So I am a specific person in this clinic, or I am the lead nurse in this clinic, or I am the ward in charge in this clinic. So just recognize that subtle difference. These changes make a lot of difference on your OET speaking marks. Okay, and the is very commonly confused. So make sure that in your introduction, you show the examiners that you understand this subtle point and you're able to form proper sentences using and the, because it's a very common mistake that people make. That's why um, we should try and use these sentences in our OET speaking. Um, so Vijay has asked, can we write the GP? So a general practice, if you use I am the GP in this clinic, that should be fine, because a GP is a specific position that you have. A doctor is non-specific. The GP is specific. Hema's asked, can we use surgery in place of clinic and practice? Yes, Hema, you can use that. So basically, just you can substitute certain words, but just concentrate on the grammar that we've used in these sentences, because they will contribute to your marks. So when you make your notes, you've already made a note of suburban practice. So practice is your word and GP is your word, and you just cut, copy and paste. Vijay, the GP is correct. All right. Then your patient has introduced themselves to you and they said, you can call me Marie. Okay. Then you say, thanks, Marie, full stop. How can I help you today? Okay, so that's one option of this. But the option that I like better is, thanks, Mary. I understand that we are here to discuss your discharge. Okay, it gets a little awkward when your notes say that you've seen this patient for a long period of time and you know that this patient is getting discharged today, and then you start your conversation with how can I help you. You can use how can I help you, I don't dispute that, but it just sounds a little better if you write that I understand that we are here to discuss your discharge. In the example that we had, we could have said, thanks, Marie. I understand that we're here to discuss your recent hospital admission. Okay, so if I go back to my notes, it says who, recent patient discharged from hospital. So then I can cut, copy, paste this, and I can write here, thanks, Mary. I understand that we're here to discuss your recent discharge. Another way we can say this is, thanks, Mary. I can see from my notes that we will be discussing your recent discharge today. Notice the differences in grammar. I understand that we're here to discuss. I can see from my notes that we will be discussing your discharge today. If you're making a plan for somebody's discharge, then you can write, thanks, Marie, full stop. I believe we are here to plan your discharge. Or, thanks, Marie, I believe we are here to plan your recovery. Thanks, Marie, the last option. What brings you to this clinic or hospital today? Guys, be very, very careful that you do not use this line on somebody who's already admitted to the hospital. This happens so many times that when I conduct mocks, the people tell me that what brings you to the hospital today, and I'm someone who's probably in the hospital dying of cancer, and this young doctor walks to me and asks me what brings you to the hospital today, I'm going to lose my mind. Okay, so remember that you need to understand your context, and that's why you need to form your notes. And through your context, you can also, probably what I would do if you struggle with that, when you're writing who, you can write old patient, new patient. Okay, so that you're sure that the line that you use doesn't consist of what brings you to the hospital today or what is your name. All right. Then, now that we've said that, we can further introduce our topic. Okay. Sometimes lots of people they come to the hospital with a lot of pain, okay, or a lot of quite adverse symptoms. So in that case, you might write something like, before we proceed, is there anything I can do to make you more comfortable? Okay. And then the patient might say, can I get some painkillers, please, doctor? And then you can just do that and your conversation will flow better. I know it's a bit too soon, but this happens a lot on your PLAB 2 exam. When you get someone with pain and you start taking their history, they get very, very agitated with you. And in order to alleviate that, we always start our sessions with, before we start, is there something I can do to make you more comfortable? But remember, we will use this line only when we're speaking to the patient. We won't use this line when we're speaking to a patient's relative, okay? Because they're not sick, it's their relative who is sick. So make sure that we're able to make that distinction. Another thing that we can use if we are going to be discussing, lots of times you get examples where the patient starts asking you about treatment and your task first asks you to just take a brief history. Okay, that if you have that task, you can use the third line, which is, prior to starting to discuss treatment options, would you mind if we briefly go through your medical history? Okay, so you can use that line in that sense. Then the fourth line, I can understand that we are in a difficult situation. I am here to help you and make you feel better. Can I briefly discuss dash? It might help us find a way to make you feel better. I really like this. I really like these lines, especially when you have things like medical error, or you have breaking bad news, or you have someone who's got a bad diagnosis, or someone who's in severe pain, or someone who's extremely anxious. Okay, so now you need to reassure them and you need to show the examiner that you understand that the person sitting in front of you is agitated, or they're angry, or they don't really like you at all right now. So in order to please your examiner, you can use this line, and that will help you score quite a lot of marks on empathy and sympathy. Instead of saying I'm sorry again and again, if you introduce yourself in this way, you will be able to score higher marks. So the line is, I can understand that we are in a difficult situation. So it's very good if a doctor and a patient, they form a team. Okay, in this way, I did not say that I can understand that you are in a difficult situation. Okay, so that sounds a bit, I'm not in a difficult situation, you are in a difficult situation. Okay, so that sounds like I'm not really involved in your situation. But if I say I can understand that we are in a difficult situation, that means that the patient and me are a team. Okay, and then I reassure the patient again, I'm here to help you and make you feel better. So that makes the patient feel that whatever I'm going to discuss is for their betterment. And then I take their permission. Can I briefly discuss your medical history? It might help us find a way to make you feel better. Okay, if I barge into a room and start asking a patient who's in a lot of pain, tell me your history, what's going on, that makes me look like a very unsympathetic and a bad doctor or a bad nurse. If I use these lines, then at least the patient has an idea that I'm asking these questions to help my patient. So then they will, even if they're in pain, even if they're agitated, they will discuss their history with me. They will tell me about their problems because they understand that the purpose of me asking their history is to decide treatment options for them. Another way that we can do this, and this is something that you won't have to modify a lot, is you can just say, I understand it's a difficult time for you. This discussion is just a way to find out a way to make you feel better. Okay, so guys, if you just want to take a screenshot of this and use this in your future introductions, that would be very, very useful. So what I'm doing here is, without taking you into the scoring criteria, I'm giving you answers which automatically fit your scoring criteria. So you'll automatically score marks on your linguistic criteria as well as your clinical communication criteria if you use these lines. I took all of the hard work that you had to do and I gave you a cheat sheet. Okay. Now, there are marks for sympathy, empathy, and appearing kind on OET speaking. A lot of students, they think that if they say I'm sorry 1,000 times in OET speaking, they'll pass. And I'm sorry, you won't. Okay. So empathetic phrases are very, very useful to show the examiner that you ticked that box for being a kind doctor or a nurse. Okay. Using words like, I can see how this must have been difficult for you. I can only appreciate how difficult it might be for you to talk about this, can be used if a patient has a difficult diagnosis, like they have cancer, or you have a breaking bad news, or they've got a mental health problem. So both these lines are applicable to them. The third sentence, I can see that you're understandably upset by this situation. This is very, very good if you've got someone who's angry with you. You try to diffuse their anger by saying, I can see that you are understandably upset by this situation. So you're justifying their anger by saying that it's understandable that you're upset. Some people, they like to add another line to this. They write, I can see that you're understandably upset by this situation. I can imagine that I would feel the same if I was in a situation, I was in a similar situation like you. Okay. So you can use that or you might not use that, but trying to diffuse anger at the start is very, very useful, especially if you've got someone who's an angry or an anxious patient. If there's someone who's extremely anxious, you might use the fourth line. I can understand it might be, it must be, don't say might be, it must be frightening for you to be in a situation like this. Okay. So if you've got a patient who's very, very anxious in front of you, probably they've got an anxiety disorder, or they've got a son or a daughter who's very, very unwell, and you have a doctor in front of you who keeps on asking about history, he keeps on drilling you or asking you questions, they're going to appear very, very unkind to you. You have to understand the patient's anxiety. Okay. And you need to show the examiner that you understood your patient's anxiety. And using this sentence does both. Okay. So you say that it must be frightening for you. So you sort of say that it's all right that they're anxious. Okay. And then you can add another line to this. You can say, I can understand it must be frightening for you to be in a situation like this, but we are here only to help you. Okay, so you might add another line to it. So if you understand the difference, I'll just try and ask your opinion now. What do you think? Will a doctor or a nurse who says I'm sorry 1,000 times better, or someone who uses these phrases? Who do you think is a better doctor or a nurse? So just type in yes if you feel like these empathetic phrases are better than someone who says I'm sorry again and again. Vijay has asked, can you repeat the last one? So Vijay, you say that I can understand it must be frightening for you to be in a situation like this, but we are here only to help you. Excellent. So now we've understood the difference between being fake sorry and being really empathetic. So that was the point of giving out these phrases to you, but these are not all inclusive. If you think you want to make more sentences, you can try and do so. If anyone has any more suggestions that they think that they might use to express empathy, they can type in on the chat window and then we'll try and give out more examples. Okay, so Vijay has said that he would write, it's totally understandable to feel this way. Vijay, that's right, and you can use that sentence. Aruna has said, I understand that this is how it appears to you, but this is how it appears to me. Aruna, you can use that, but that doesn't sound very, very empathetic. What I would do is I would change that to, I can understand that this may appear very dismal to you, but the way it appears to me now is that we're here to find a solution to your problems. So I'll just change your sentence to make it a little more empathetic. I can understand how it may appear to be dismal for you. This is how it appears to me. We are here to help you in the best possible way. Dr. Jabbar has written, I understand how it is panic to you. Don't worry, I'm here to discuss to find a better way for your health. To Dr. Jabbar, I would like to make a lot of, I would like to change that statement again. It should be how it may be stressful to you, not maybe panic to you, because panic is a very negative word. Stressful is a better word to use here. Maybe very stressful for you, not to you. Don't worry, I'm here to discuss and find a better discuss and find a better way to help you, not way for your health, way to help you. Wahida has given a very good sentence. She's written, I can understand that this is daunting for you. Excellent. So daunting, if anyone doesn't know, daunting basically means something which is scary or alarming. Okay, so you can use that sentence as well. That's a very good sentence. Aparna has said, I can understand you completely. It must be a very difficult situation that you're going through. So Aparna, that's a very good sentence as well. Excellent. Aruna has said, I can understand. I would also feel the same way if I was in your feet. So Aruna, it should be, I can understand. I would also feel the same way if I was in your shoes. Okay. Some people don't like that sentence. Some doctors actually go against that sentence, especially very senior doctors, especially if you've got someone who's got quite a grave diagnosis, like someone with a new diagnosis of cancer, multiple sclerosis. I won't really write, I would feel the same way if I was in your feet. You would write, I can only imagine that I would feel the same way as you if I was in your shoes. Okay. Dr. Khan said, I can understand your concern. So Dr. Khan, it should be your concerns, not your concern, because they've got lots of concerns, not just one concern. So you understand all of your concerns. Let me explain you. No, it shouldn't be let me explain you. It should be let me explain to you further so that we can grow from there. Middle of Nowhere has asked, isn't there some sort of testing of clinical insight? Shouldn't they be concerned with our English? So if you go through the scoring criteria, there are two things in it. You have your English and you have your clinical communication. Okay. The OET understands that a lot of doctors or nurses who come from foreign countries, they struggle with the cultural gap as well. That's why they think that their clinical communication might also lack. So if you go through the official scoring criteria, or if you go through my previous lectures, you'll see that clinical communication is a part of OET speaking, and it's very important that it is a part of OET speaking, because this is your first practical experience and it primes you for your future tests. Nimish has said, I can understand it is challenging for you to cope with this situation, not cop up. It should be cope with this situation, but don't worry, you will be fine. No, don't write you will be fine. You write don't worry, we're here to help you, because Nimish, remember, because doctors and nurses cannot treat everything. If you've got someone with cancer who's going to die tomorrow, if you tell them you will be fine, you're lying to them. Okay. You tell them, don't worry, we're here to help you and we will do our best to help you. Aruna has given a very good sentence, which is, I understand your concerns. You're in safe hands. Don't worry, we're here to help you in the best possible way. Aruna, if you write, please don't worry, we're here to help you in the best possible way, it's a little better. Excellent. So lots of good examples, lots of empathy in this session. So we'll move on now. Remember everyone that you have multiple tasks on your OET speaking. Okay. Like in our example, we had a point where they had to discuss previous history, then they had to discuss exercise, then they had to discuss cardiac rehab. So there were a number of points which were to be covered on their OET speaking. In order to form a logical and a sort of a good organization to your OET speaking, you need to signpost changes in topics. Okay, how do you do that? We've got sample phrases here that we might apply to our examples. You can write, now that we've discussed your previous history, we should now try and discuss your needs for exercise, or we should now try and discuss your exercise regime. Or you can write, now that we have gone through your your previous admission, we should now move on. We should now try and move on to your plan for cardiac rehab. So we have discussed diet till now. Now let's try and discuss exercise. Okay. So these are the way that you signpost changes from discussing exercise to diet or history to cardiac rehab. We saw on the scoring criteria that there were marks for organization and layout. In your OET writing, you can separate your topics by paragraphs. In your OET speaking, you can separate your you can sort of organize your speaking by using signposting. Okay. Um, Another way that we can signpost is, thanks for sharing your history with me. Let's try and discuss some treatment options now. So that's the way how you move from history to treatment. Another way is, thanks for sharing your concerns. There are a few treatments we can offer which should help in making you feel better. Would you like me to discuss them with you now? So I really like this option because first I can copy paste this in every speaking that we do. So it should be, thanks for sharing your concerns. There are a few treatments that we can offer which should help in making you better. Would you like me to discuss them with you now? Gulam has asked, can you please describe the signpost term? Gulam, if you're traveling on a road and when you when you're traveling towards a destination, you might see signs at the side of the road or roadside signs which might tell you how many kilometers are left. Okay. So signposting is similar to this. At every point in the conversation, it's going to tell you this topic has stopped. Now this topic begins. This topic has stopped. Now this topic begins. Okay. Every history that you took as a doctor or a nurse working in a hospital used to start out with your presenting complaint, your examination, and your treatment. Okay. When you're doing your OET speaking, you signpost changes in topic. Okay, now that we've discussed your history, we move on to examination. Now that we've discussed your examination, we move on to treatment options. So signposting is similar to putting points when you're writing a paragraph. So first point, history. All right, now we're going to discuss your history. Second point, examination. All right, let's talk about your examination now. Third point, your treatment options. All right, we're going to go through the treatment options we can offer you now. Sajid has asked me a very good question as to how to take personal history. Guys, remember, sometimes you have to ask your patient a few points which might be awkward. For example, their sexual history. So when you signpost personal history, you tell your patient, thanks for telling me about thanks for talking to me about your concerns. I would like to ask you a few points in your history, or a few points about your lifestyle, which might sound a little too personal, but it's only a way for us to treat you better or find solutions for your problem. Is that all right if I ask you a few personal questions? So Sajid, that's a way that you can do. So I'll just write that down. I need to ask you a few questions which might be a bit personal. This is only to plan treatments for you. only to plan. Sorry, it shouldn't be it should be to plan treatment for you. Okay, so that's the way that you can try and ask personal history. Remember, lots of people make this mistake. Asking about alcohol and smoking isn't personal history. That is something that people are very comfortable with, especially in or in Western countries. So if you want to ask about smoking or alcohol, you don't need to start out with this, I need to ask you a few questions, which might be a bit personal. You can ask them that I just need to ask you a few questions about your lifestyle patterns. So I just need to ask a few questions regarding your lifestyle pattern. So you can try and use that. SP has said, can I ask a few questions about your personal life? So SP, that sounds a bit awkward because personal life basically points out to your partners or your family rather than drug history or sexual history if you want to ask. So a few personal questions should be better. So can I ask a few, would it be possible to ask a few questions about your personal life or about your personal situation? Dr. Jabbar Imran has asked, can we say, have you got my point? No, Jabbar, please do not say that. Do not say, are you following me? Because that's something that we do use in Eastern countries, and that's something which is considered rude in Western cultures. You can ask, are there any questions that you would like to ask me before we proceed? That sounds a little better. We just said, is it all right to ask a few questions regarding your lifestyle? That's fine. Harmik has asked how to approach a patient who keeps on asking, what if I die out of it? Harmik, you can say, I can understand your concerns. I know you're understandably anxious about this situation. We're here to figure out a treatment plan for you, which should hopefully make you feel better. No, Sajid, we shouldn't say, are you following me? No, that sounds very rude. All right. Now, like in this, in this example, we had to offer a lot of advice to this patient. Okay, so we'll now tell you a few phrases which you can use to offer advice to someone. Okay, I won't say that you start with you need to do this, you do that. Okay, you need to just introduce that you're starting to offer advice. So that's your signpost to offer advice. So how you may do that is, thank you for sharing this with me. I can understand your concerns. Let's now try and discuss what might help in easing the situation, or which might help in this situation or help with this situation. Everything's correct. Then thank you for sharing your concerns. I'm here to help you. Let's try and figure out now how we can deal with this situation and make you feel better and more healthy soon. Or thanks for sharing your concerns. Let's try and plan how we can start getting you back on track to health soon. So guys, all of these sentences, you can copy them. You can apply this in most OET speaking. Okay. So take a screenshot of this if you want. You can use this on your OET speaking when you start to offer advice to a patient. Dr. Khan has said, can we say, I hope we're on the same page? That's fine. But again, better is, I'm going to move on to your examination now. Before we do that, Do you have any questions that you would like to get answered? Anita has asked how we can ask they are following our instructions. Anita, you can introduce it as in our previous discussion, we discussed whether how we can give you certain medications. Are you having any problems in complying to the medications or complying with the treatment? Or are you having any problems in maintaining a good schedule, or are you exercising regularly like we discussed recently? So that's how you can follow up on treatments. All right. Now, some phrases which you can use to give advice. It will be very helpful if you could try and maintain a good exercise regime. It is crucial that you exercise in order for you to start feeling better soon. It is recommended that you exercise regularly. It is paramount that you exercise regularly. It is imperative that you try and stop smoking, or it is imperative that you try and start exercising. All right. Some more phrases to give advice. I've just tried to highlight the tense that we've used, which I had just asked for the previous slide to be shown. So I'll just quickly, Vijay, if you can take a quick screenshot of this, and then we'll move on. While we're doing that, Sean has asked, when an examination is not mentioned, how do we know that we have to move to questions regarding examination? Sean, what I meant by my example is signposting means moving on from one task point to the other task point, okay? Like in the example that I showed you, your task points were first to talk about the patient's recent hospital admission, then to introduce the cardiac rehab at a previous hospital, then to talk about fatigue, okay? So the signposting that we have to do is from one task point to the other. All right, now we're going to discuss the examination for this patient, or now we're going to discuss the treatment options that we have. We're going to first discuss cardiac rehab. Then GBS Rohit has asked, how can we proceed on with a reluctant patient? You can use the empathetic phrases that I provided. As you can say, I can understand that it might be difficult for you to talk about this, but we're here only to help you. Okay, that might help you with a reluctant patient. Similarly, Sajid, if a patient is reluctant to take advice, then you can say that I know it can be very difficult for you to deal with this situation, but the advice that we're giving you is only to help you. All right. Now, some phrases that we can use, some phrases that we can use in order to give advice are these three. The reasons that I've made some things in bold is because these are common mistakes that people make. Some phrases that we can use are, I would strongly suggest that, I would strongly advise that, I would strongly urge you to, and then you put in start exercising. So that's an ing after the verb that you want them to do. Or stop smoking. So instead of smoke, you cut down the e and you add ing. Another thing that you might use for a reluctant patient, Sajid, you might add, this might be difficult at first. However, comma, stopping smoking, stopping drugs, starting these medications might be essential to get you back to your healthy self. So Sajid, if you have doubts with reluctant patients, you might use this phrase and it's very useful. If a patient is very sad or they're very anxious with their diagnosis, you might write, I am sorry that this might be difficult for you to hear. However, smoking, drinking, using drugs would only make the situation worse. We need to figure out ways in order for you to stop smoking, stop drinking alcohol, stop using drugs. So this might be quite useful if we're uh, talking about reluctant patients. Bob has asked, can we ask some extra questions relative to the task or just stick to task statements? Bob, I would suggest you to stick to task statements because you have only 5 to 7 minutes. If you start using your medical language or asking questions relating to the things that you think might be pertinent as a senior doctor or a senior nurse, you're going to run out of time. Vijay has asked, can we use hand gestures? Vijay, remember that only the recording is forwarded to the examiner, so they might not be able to see your gestures. But body language, especially if you're practicing clinical communication, might be more useful if you're planning to do your CBT exams or your PLAB2 exams, and they become very, very important then. All right. Now we're moving on to a nursing task, okay? The reason why I've showed this example is that now the situation is switched, okay? Now we have someone who is not the patient themselves, they're a patient's relative, okay? And I've modified all of my phrases to fit the person being a relative. Okay, so your introduction will be, hello, my name is whatever your designation is or whatever your name is. I am a doctor working in this, and then you introduce yourself as, is that Anna's mother, father, relative, or carer? And then you say, how can I help both of you today? Okay, so that's something that we can use. If this is someone who's new to you, before we start, how may I address you? Can I please confirm your child's son, daughter's details as well? Okay. Then empathetic phrases also can be modified if you're dealing with a relative rather than the patient himself. You can write things like, I can see how this might be difficult for you and your son. Okay, so you sort of include both of them. I can only appreciate how it might be, how difficult it might be for you to talk about this as it is your son, or as this is your son. So just see how we've modified our empathetic phrases to suit our situation. I can see that you're understandably upset by this situation as your child is unwell. You can use this if you've got someone who's very, very anxious about their child. I can understand it must be frightening for you to be in a situation like this with your child being unwell. So both of the last two sentences, you can use them for parents who are very, very anxious about their children. Please remember, you need to make sure that you understand that the person in front of you is just the patient's relative. So empathetic phrases have to be modified for a relative. Rahin has asked, when a patient is giving history, what do we have to say? Okay, all right. You can do that, Rahin. And then at the end, you can say, all right, thank you for giving me your history. Is there anything you would like to add? Again, the phrases to give advice also need to be modified as to, I would strongly suggest that your child should take his medications, or I would strongly advise that your child starts taking his or her medications. So if you just take a screenshot of this, this is how you will modify your phrases to give advice for when the patient and the person in front of you are different people. Okay. Now, the last point that we covered today is just about when you have to take a history from a patient and then offer them advice is this one. So this is an example where you have to find out what the parent already knows about eczema. So if you take a screenshot of this, you can introduce your topic as, because this parent is very, very anxious, you can say, I can understand that we're in a difficult situation. I am here to help you and make you feel better. Can I briefly discuss whatever history you want to discuss, and then so that we can get a sense of your background knowledge. Okay, I understand it's a difficult time for you. This discussion is a way to is just a way to find out, is there a way to make your child feel better? Before we start, can I just ask, what do you already know about eczema? SP has said only for nurses or doctors can also use these phrases. SP, all of this session is for doctors and nurses, and these phrases can be used interchangeably. Okay, so what we'll do, we've run out of time today. I'll try and do another session on speaking next week, where we'll try and cover bad news. I think because lots of people had questions and difficult patients. But if you go to our YouTube channel and you go to Teacher Academy, if you Google, if you search Teacher Academy on YouTube, you'll be able to see 2 sessions that I've done on breaking bad news and a difficult non-compliant patient. Okay. SP has said an emergency situation also. So I'll try and cover difficult scenarios next week. We'll probably do it on Friday, on next Friday, and then we'll try and cover difficult patients and try and take a few examples. I think the session ran quite late today. That's why I had to shut it down. But I hope that you've learned something new. And I hope that you are able to take a bit of this task back to your OET and add something to your OET speaking, and hopefully it should increase your marks. Sajid has asked, if I can't complete my task in time, is there any reduction of marks? Sajid, it depends on how well you perform your task. If you do, if you have good English, good communication skills, they won't really penalize you much, and you should be able to pass still. All right. So that was the end of your session today. Sushma, it would be around 11 o'clock, so 2 hours before this session. I would mention that if you want to practice with teacher, you can go through our YouTube channel, or you can schedule some practice sessions or some sample speaking sessions with teacher. If you go to our website, teacheracademy.com, you should be able to schedule some practice speaking sessions. Guys, remember, if the OET becomes online, your exam is sooner than you know. So just start getting back in the groove. I know lots of people have gotten used to the fact that probably our exam is in July or August. We don't need to practice now, but you still need to keep practicing, especially with speaking. If you practice your speaking now in advance, you'll be able to save time for writing and reading, which are probably more difficult. And you won't be wasting time on speaking, because speaking is something that you can just practice. And then if you maintain that practice, you'll be able to spend little time on it, and then you'll be able to focus on writing as well as speaking. Aruna, it's about 6.99 British pound per speaking session, but you can order some bulk sessions. But obviously the YouTube channel has got free videos which you can check out. Thanks again, guys, for joining in. I hope you had fun. You learned something new, and I hope you do well on your OET speaking. Remember, Mr. Manoj is going to hold a session on writing grammar again on Sunday, so make sure that you join for it. The link will be provided to you in due course. But guys, please keep practicing, please keep having fun, and good luck.